is a detailed and comprehensive breakdown of the hepatitis B vaccine. Hepatitis B vaccine, detailed information, generic name, drug class, drug forms, brand names. Generic name, hepatitis B vaccine, recombinant class, inactivated viral vaccine, recombinant subunit vaccine. Drug forms, suspension for intramuscular injection, available in single-dose vials, multi-dose vials, and prefilled syringes. Brand names Ingrid GlaxoSmithKline, Recombivax HB, Merck & Co., Heplisav B, Dynavax Technologies contains a novel CpG 11018 adjuvant. Twinrix, a combination of hepatitis A and B vaccine. 2. Definition. The hepatitis B vaccine is a non-infectious recombinant DNA vaccine designed to protect against hepatitis B virus, HBV, infection. It works by stimulating the immune system to produce protective antibodies, anti-HBs, against HBV, thus preventing infection and related complications such as chronic hepatitis, liver cirrhosis, hepatocellular carcinoma. 3. Mechanism of action. The vaccine contains purified hepatitis B surface antigen, HBsAg, produced using recombinant DNA technology in yeast cells, Saccharomyces cerevisiae. Upon injection, HBsAg is recognized as a foreign antigen, prompting the body's immune system to produce specific antibodies, anti-HBs. These antibodies provide active immunity by recognizing and neutralizing the actual hepatitis B virus upon future exposure. In Heplisav B, an advanced adjuvant, CpG 1018, enhances the immune response, allowing for faster protection with fewer doses. 4. Indications. The hepatitis B vaccine is indicated for general, routine childhood immunization, catch-up vaccination for unvaccinated children and adolescents, pre-exposure prophylaxis in high-risk populations, high-risk groups, healthcare professionals, lab workers, infants born to HB-ZAG-positive mothers, patients with chronic kidney disease or on dialysis, people with multiple sex partners, STIs, or IV drug use, people with chronic liver disease or HIV infection, travelers to regions with intermediate high HBV prevalence, household sexual contacts of HBV-infected individuals. 5. Contraindications. Severe allergic reaction, e.g. anaphylaxis, to a previous dose of hepatitis B vaccine, any component of the vaccine, e.g. yeast, moderate or severe acute illness, e.g. high fever, temporary deferral recommended. 6. Precautions before taking this medicine. Tell your doctor if you have a fever or infection, you are allergic to yeast or any other vaccine component, you have a weakened immune system, e.g. cancer, HIV, you are taking immunosuppressive therapy. You have a history of neurological conditions, e.g. seizures. You are pregnant or breastfeeding, safe in most cases, but consult your provider. You previously had Guillain-Barré syndrome. #7. How to use. Intramuscular injection only. Preferred site, infants and young children, anterolateral thigh, older children and adults, deltoid muscle. Do not administer intravenously, intradermally, or subcutaneously. Shake the vial or syringe well before administration. Observe for 15 minutes post-vaccination for any immediate allergic reactions. SAS8. Dosing information schedule. Engerix B, Recombavax HB, 3-dose series at 0, 1, and 6 months. Dose for infants and children, 0.5 milliliters. Dose for adults, 1 milliliters. Alternative accelerated schedule, 4-dose series, 0, 1, 2 months, Plooster at 12 months for rapid protection. Heplisav B, adults to 18 years, 2 doses, 1 month apart. Not approved for use in children or pregnant women. Twinrix for adults to 18 years, hepatitis A and B. 3-dose series, 0, 1, and 6 months. 9. Missed dose, overdose. Missed dose, take as soon as possible. There is no need to restart the entire series, even if a long time has passed. Overdose, rare. No specific antidote. Monitor for adverse effects and treat symptomatically. 10. When to stop or avoid taking. If you develop anaphylaxis or other severe allergic reaction, if a serious illness or fever is present, delay vaccination. Known allergy to yeast or vaccine components. If your doctor advises against due to immunologic conditions. 11. Side effects in detail. Common 1 to 10%. Pain, redness, swelling at injection site, fatigue, headache, dizziness. Mild fever, irritability in children. Less common 1%. Nausea, vomiting, abdominal pain, diarrhea, joint pain, muscle aches. Rare but serious. Anaphylaxis, Guillain-Barré syndrome, seizures, febrile, thrombocytopenia, lymphadenopathy, hypersensitivity reactions, e.g. urticaria, angioedema. 12. Vital information. Provides 90% protection after full immunization. Long-lasting immunity, often lifelong. No live virus in vaccine. Cannot cause HBV infection. Booster doses not routinely needed except for immunocompromised. Infants born to HBsH+ mothers should receive vaccines HBIG within 12 hours of birth. Proper storage, 2 to 8 degrees Celsius, do not freeze. 13. Other drugs will affect. Drug interactions. Immunosuppressants, corticosteroids, chemotherapy, HIV meds, may reduce immune response. Co-administration with other vaccines can be given simultaneously with other inactivated or live vaccines at different sites. No known interactions with most routine medications. Medical conditions affecting efficacy. Chronic renal failure, liver disease, HIV/AIDS, diabetes mellitus, slightly lower antibody response. Thank you. Have a nice day.